The National Marfan Foundation is proud to present the 2011 Scientific Leadership Award to Shriners Hospitals for Children. Since 1922, when the Shriners opened their first hospital in Shreveport, Louisiana, the hospital system has expanded to 22 hospitals and will soon treat its 1 millionth patient. Most of these patients were treated free of any charge. Here in Portland, the Shriners Hospitals for Children treats about 10,000 children per year. In the past decade, the Shriners Hospitals for Children have treated nearly 600 children with Marfan syndrome. Shriners is known not only for its high-quality patient care, but also for its dedication to orthopedic and basic scientific research. It has a long-standing commitment to Marfan syndrome and related disorders, and there is no doubt that these conditions are better understood today because of the work they have funded. Dr. Lynn Sakai, who has been a member of the NMF's Professional Advisory Board since 1997, has been conducting research at the Portland Shriners Research Center for nearly 28 years. During that time, Shriners has supported her Marfan syndrome research with close to $7.5 million in grants. The very first grant Dr. Sakai received from Shriners laid the foundation for the identification of fibrillin and led to advanced work that pointed to the candidate gene for Marfan syndrome. Through the collaborative efforts of Dr. Sakai and her colleagues at other institutions, this research has made it possible for scientists at Johns Hopkins to identify the first mutation in fibrillin 1 in a patient with Marfan syndrome. It also helped to advance the understanding of the structure of the molecule and how it controls growth factors. The work done in Dr. Sakai's lab has translated into the molecular diagnostics used in clinical labs to aid in the diagnosis of Marfan syndrome and other connective tissue disorders such as Loeys-Dietz syndrome. As a result, the genetic testing for Marfan syndrome has become reliable to the point that it is included in the 2010 diagnostic criteria for Marfan syndrome and plays an important role in the differential diagnosis of Marfan syndrome from among several other related connective tissue disorders. With the support of Shriners, Dr. Sakai's lab is also conducting vital molecular research on TGF-beta signaling in Marfan syndrome, work that is being translated to the patient level at Johns Hopkins and is the basis for the clinical trial on losartan and atenolol that is underway. Today, the NMF is proud to present the 2011 Scientific Leadership Award to Shriners Hospitals for Children for its patient care and research accomplishments to date and for its ongoing commitment to the basic science that will lead to a better life for people with Marfan syndrome and related disorders in the future.